Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we will discuss a topic that has been in the news for several weeks, yet the vast majority of people are unaware of what it is: Eastern equine encephalitis. Some know that the cause is a mosquito, while others have no idea about it. Given its high fatality rate and propensity for serious neurological consequences, endemic locations of EEE provide serious health hazards. This video provides a thorough review of this dangerous disease by examining the important characteristics of EEE, including as its transmission, clinical signs, diagnostic techniques, and preventive strategies. To safeguard the health of people and animals, it is essential to comprehend the effects of EEE, its management, and prevention techniques. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's go to the video. The virus and its transmission cycle. The Eastern Equine Encephalitis virus, EEV, an alphavirus belonging to the Togaviridae family, is the causative agent of Eastern equine encephalitis. The virus known as EEEV is encapsulated and has a single-stranded RNA genome. 3 structural proteins, C, E1, and E2, and 4 non-structural proteins, NSP1, NSP4, make up the virus and are necessary for both infection and viral replication. The main vectors of EEEV transmission are mosquitoes. The virus finally penetrates the blood-brain barrier to induce encephalitis by targeting endothelial cells and cells in the mononuclear phagocyte system. The disease's aggressive course is exacerbated by this neuroinvasive characteristic. Transmission cycle. Mosquitoes act as vectors and birds serve as the main reservoirs in the EEE transmission cycle. Birds are essential to the virus's persistence in the environment because they can tolerate high virus concentrations without becoming seriously ill. This is especially true with songbirds. After feeding on viremic birds, mosquitoes, especially Culicida melanura, acquire the virus and subsequently spread it to humans and equines. Environmental factors. Climate conditions like humidity and temperature have an impact on EEE transmission. The risk of transmission rises with warmer temperatures and high humidity, which encourage mosquito activity. The best places for mosquitoes to breed are areas with lots of freshwater wetlands, which are common in EEE endemic areas. Geographic distribution. The eastern United States, particularly the Atlantic and Gulf coasts, is where EEE is most commonly recorded. Additionally, regions of Central and South America, the Caribbean, and Canada have shown signs of viral infection. The existence of appropriate mosquito vectors and avian reservoirs affects its geographic spread. Symptoms and clinical manifestations. Symptoms in humans. EEE takes anything from 4 to 10 days to incubate. A fever, chills, headache, nausea, and vomiting are some early symptoms. As the illness worsens, serious neurological symptoms could appear, such as intense headache, rigid neck, light sensitivity, convulsions, confusion or disorientation. The most severe type of the illness, encephalitis, is marked by inflammation of the brain and has a high death rate. Long-term neurological abnormalities, such as cognitive impairment and movement issues, may affect survivors. Symptoms in horses. EEE is especially deadly in horses, where the death rate approaches 90%. Fever, lethargic behavior, and appetite loss are among the initial signs. As the illness worsens, horses may exhibit neurological symptoms like incapacity or stammering, circling, tremors, paralysis. Within a few days of experiencing severe symptoms, horses usually pass away. The high death rate emphasizes how crucial early detection and immunization are. EEE in different animals. Aside from humans, birds, reptiles, and amphibians can also contract EEE. The main reservoirs for the virus are birds, who may carry it without exhibiting symptoms. Though outbreaks among these animals are rare in comparison to human and equine populations, reptiles and amphibians are susceptible to mild to moderate disease. Diagnostic methods. Antibodies specific to EEEV are found in blood or cerebrospinal fluid, CSF, via serological testing. Typical exams consist of IgM antibody capture ELISA. MAC ELISA identifies early IgM antibodies that are exclusive to EEEV, MAC ELISA. Hemagglutination inhibition, HI identifies antibodies that prevent red blood cells from becoming agglutinated by viruses. Neutralization test determines how well antibodies are able to neutralize the virus. Polymerase chain reaction. Viral RNA from blood, CSF, or tissue samples is amplified via PCR. It is helpful for early virus identification because of its excellent sensitivity and specificity. Analysis of cerebrospinal fluid. Elevated protein levels, increased white blood cell counts, and the presence of IgM antibodies specific to EEEV are frequently seen in CSF investigation of cases of encephalitis. Treatment options. For EEE, there is no particular antiviral medication. Supportive care consists of the following: intravenous liquids to keep the body hydrated, respiratory support for severe cases, anticonvulsants to manage seizures, pain control for discomfort and headaches. Experimental treatments, including antiviral agents and immunotherapy, are under investigation but are not yet proven effective in humans. Prevention and control. Monitoring and surveillance for mosquito control. Keeping an eye on mosquito populations and testing them for EEEV makes it easier to identify early indicators of rising viral activity. Important data on virus prevalence can also be obtained by sentinel animal and bird observation. Adulticiding and larviciding. Adulticiding is the practice of spraying pesticides to kill adult mosquitoes, whereas larviciding targets mosquito larvae in breeding locations. By taking these steps, mosquito numbers and the chance of EEE transmission are decreased. Modification of habitat. Mosquito populations can be further decreased by removing standing water and altering mosquito breeding grounds. Personal protective measures. Insect repellent. Biting mosquitoes can be avoided by applying repellents that contain DEET, picaridin, or oil of lemon eucalyptus. Wearing protective apparel. By donning long sleeves, long pants, and socks, one can lower their chance of skin exposure and mosquito bites. Avoiding peak mosquito activity. Reducing outside activities during the mosquito-active hours of dawn and evening can help minimize exposure. Using mosquito nets and screens. Screens and nets offer extra security and aid in keeping mosquitoes out of dwelling areas. Vaccination in horses. For horses, vaccination is an essential prophylactic step. Usually, the immunization regimen consists of 2 initial doses, then yearly booster shots. Immunizations work wonders in preventing EEE, but getting them to everyone and providing access to veterinary care are obstacles. Impact on public health and economy. EEE has a substantial influence on public health, especially during epidemics. Healthcare systems are heavily burdened by the high cost of treating severe cases and the long-term care needed for survivors. The loss of valuable horses has a significant financial impact on the equine industry as well. Healthcare system burden. Severe EEE cases frequently call for hospitalization and rehabilitation in addition to intense medical care. Care can come at a high cost, especially in places with few resources. Economic consequences. Due to EEE, the equine industry suffers large financial losses, particularly in industries where the use of horses is necessary for labor, breeding, or racing. Vaccination and preventive actions can lessen these financial effects. Recent advances and future directions. Emerging research and potential treatments. Research on vaccines, therapies, and diagnostic techniques have all contributed to our growing understanding of Eastern equine encephalitis, EEE. Improving early detection through quicker and more precise diagnostic testing is one area of attention. In order to improve patient outcomes and treatment timeliness, researchers are developing point-of-care diagnostic systems that may yield faster answers. Research on antivirals. Finding medications that can stop the EEE virus from replicating or strengthening the body's immune response is the goal of ongoing research into antiviral therapies. Novel antiviral drugs that target viral enzymes or host cell components necessary for viral replication are promising possibilities. Additionally, studies are being conducted on the potential use of monoclonal antibodies to neutralize the virus and lessen its effects. Vaccine development. A human vaccination for EEE is currently being developed. Numerous vaccine platforms, such as live attenuated vaccines, recombinant vaccines, and inactivated virus vaccines, are being studied by researchers. Immunology and genetic engineering developments could lead to the development of strong vaccinations that offer long-term defense against EEE. Initiatives in public health. The main goals of public health programs are to raise awareness of EEE and encourage preventative measures. Campaigns for community education seek to educate the public on the dangers of diseases spread by mosquitoes as well as the value of applying repellents, donning protective gear, and removing mosquito breeding grounds. Additionally, tracking and managing EEE outbreaks requires cooperation between researchers and public health organizations. Climate and environmental factors. The effects of environmental variables and climate change on the spread of EEE are also being investigated. Variations in temperature and precipitation can have an impact on mosquito populations and their environments, which may have an impact on the frequency of EEE. It is essential to comprehend these elements in order to forecast and control upcoming outbreaks. A serious mosquito-borne illness with substantial effects on public health and the economy is Eastern equine encephalitis. It is essential to comprehend the symptoms, diagnosis, treatment choices, and cycle of transmission of the virus in order to manage and prevent EEE. To lower the danger of EEE, public health initiatives including mosquito control, human protection, and horse immunization are crucial. In order to improve outcomes and successfully manage the disease, more research must be done on vaccines and treatment options. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next video.